and completion of a dietetic internship from the University of Tennessee, Knoxville. She also holds a doctorate of philosophy and kinesiology from Texas A&M. Adriana has had the privilege of working at the Johns Hopkins Children's Center as a pediatric dietitian in between earning her master's and doctorate degrees. Please join me in welcoming Dr. Coletta. We're very happy to have her today.
Thank you, and thank you so much, everyone, for coming today and being here. I'm really excited to talk to everyone today about obesity and how obesity is a risk for various different types of cancer. So before today, or before seeing the headline of this talk, how many people thought that obesity could possibly be linked to cancer or cancer risk? Excellent. All right. So today I'm going to do a quick review about obesity, and then we're going to talk a little bit more about how obesity is linked with cancer risk. So we're going to review the characteristics of obesity, formulate a definition so we're all on the same page. We're going to talk about how prevalent obesity is here in the United States. We'll talk about some risk factors for developing obesity, and that's really where I'm going to hone in on the complexity of this condition. Then we'll talk about health complications that are related to obesity, further demonstrating the complexity of obesity. Then we'll hone in a little bit on cancer types associated with obesity. Then I'll take a step back and talk about how obesity is linked to health complications, because that will help better explain how obesity is linked to health complications, then links to increasing cancer risk. And then finally, we're going to talk about what you can do to reduce your risk of obesity and developing cancer, the cancer types that are linked with obesity. So let's start talking a little bit about characteristics of obesity. So how would you guys describe obesity? Any volunteers? Someone tell me how would you define obesity?
Related to body mass index.
Okay, body mass index. Any other definitions, or what do you guys think about when you hear about what is obesity? Anybody?
Waist measurements.
Waist circumference, very good. So those are two really important points. So obesity is defined partly as an excessive accumulation of body fat. So we can measure that with our body mass index. So that's our ratio of height in kilograms to, weight in kilograms to height in meters squared. So overweight is defined as having a body mass index between 25 and 29.9. Obesity is defined as having a body mass index greater than or equal to 30 kilograms per meter squared. There's a lot of different ways that you can calculate your body mass index. You can either calculate it by converting your weight to kilograms. There are 2.2 pounds per kilogram. You can convert your height to meters. First, you can go to centimeters, 2.54 inches in a centimeters in an inch, and then you can convert to meters and square it. Or there are also various online calculators. So you can Google body mass index calculator and figure out what your body mass index is. Someone mentioned waist circumference. So it's also important to mention that there are different types of body composition and different places that this excess fat accumulation is deposited. So the two main ones, let's see. Okay, here we go. So you have this apple shape. This is your more abdominal obesity, or that android obesity. And then we have this pear shape, and that's considered gynoid obesity. And really, what we know from the literature is this pear shape is not as adverse as having more of this apple shape or more excess fat deposited in your abdominal region. However, overall big picture, regardless of whether you're more of an apple or a pear shape, being obese still increases your risk of different health complications, and that's important to note. So when we talk about why is that apple shape really increases our risk of obesity, and how is that more how does that more negatively affect our health? So this is because there are two different areas where excess fat can be accumulated. So we have the subcutaneous fat, and that can be anywhere throughout the body, and then we have this visceral fat, and this is really where we see a lot of problems when we get this excess accumulation of this fat that surrounds our organs. And so a lot of research has shown that it's that visceral fat especially that increases risk of different health conditions, which we'll talk about. So how prevalent is obesity in the U.S.? So about 36% of adults in the U.S. are obese. Now, if we add overweight, how many individuals in the United States are overweight and or obese? That actually increases to about 70.7%. 70.7% of this nation is either overweight or obese. When we look at the obesity heat maps, we see here across the country, especially in Texas, this is 30 to less than 35% of Texans, adults, men and women, are considered obese. The darker the color, the higher the percentage. So these states right here, greater than or equal to 35% of adult men and women are considered obese. Now I'm going to talk a little bit later about the different risk factors that contribute to obesity, and we're going to talk a little bit, touch on genetics. So it is important to mention that there are, based on race and ethnicity, obesity looks different. So some different groups may be at increased risk. So in the United States, 48.1% of non-Hispanic African American adults, men and women, are obese. 42.5% of Hispanic adults are obese. And 34.5% of non-Hispanic Caucasian adults are considered obese. And I believe the percentage for Asian adults, men and women in the United States, is about 18%. So the bottom line is that obesity and overweight is very prevalent in the United States. We also, when we think about how does this look like when we break it down to age, we see that there's this sweet spot of age between 40 to 59 years old where we see the highest prevalence of adults that are obese, about 40%. And then as we get just a little bit older, as we advance greater than 60 years old, there's a slight drop, but still all surrounding that national average of about 36%. Excuse me. So, how do we get at risk for developing obesity? So, genetics. So there's actually two different types of genetic conditions. There are two different, bins or categories linked with obesity. So you have monogenic obesity. One gene contributes to the risk of obesity. And an example of that is like Prader-Willi syndrome. Then you have polygenic obesity. That's multiple genes that contribute to this increased risk of obesity. And polygenic obesity is that's considered the common obesity. That's really what we see most often. So it's this contribution of many genes that can add to increasing one's risk of excessive accumulation of body fat. What are some other risk factors? Physical inactivity. And this really touches on this concept of energy balance, which I'm really going to touch on a lot throughout this talk. Can anyone have any ideas of what energy balance means? Anyone want to throw out a definition? Yes, ma'am.
The balance of what energy you put out as opposed to what food is your food intake.
Absolutely. So energy balance is how much energy or calories you're taking in versus how much you're burning or putting out. And we wish that obesity could be as straightforward as energy in, energy out. But I hope that I convince you today that there are many risk factors that contribute to energy balance that impact our risk of developing obesity. So we have inactivity, so we're not exercising, we're not burning enough calories. There's also an unhealthy diet, which then is going to increase the amount of energy you're taking in. So if you are eating more energy-dense foods, so that means higher calorie foods for a smaller serving, like a piece of fried chicken versus a piece of baked chicken, more calories in that food. You're taking more in, so that's another contributor. Also, your family lifestyle or environment that you live in can also contribute to developing obesity. An environment can be anywhere from really also where you live, access to healthier options. Could you be in a food desert where there aren't a lot of healthy options? Certain medications can impact metabolism. It can also impact your appetite and how much you're eating. So that contributes to developing obesity. If you recently quit smoking, so that is related to this oral fixation of now the cigarette's gone, so what's coming in? And so in a lot of cases, and the tobacco treatment folks are a little more, they can speak to this a little better than I can, but usually it's food. At eating food instead of smoking the cigarette, which can then contribute to increased energy intake, offset that energy balance, and increasing your risk for developing obesity. And then, of course, there's lack of sleep. Recent research is really showing us how connected sleep is to our appetite and our dietary habits. Stress as well. So excessive stress can lead to stress eating, which can increase our risk of developing obesity. Pregnancy. So if you've gained some weight with pregnancy, sometimes it can be harder to lose that weight, or it's harder to change eating habits, so that can increase your risk. And then, of course, age. As I was showing you before, as the increase in age with the increase in prevalence of obesity. So these are all risk factors for developing obesity, and the purpose of this is to really show how complex this condition is, because there are so many things that contribute to energy balance, and that can lead to weight gain, excessive accumulation of fat tissue, and obesity. So, and also social and economic issues. So that can be another issue of, again, the whole idea of having access, being able to purchase healthier food items, also social situations. What does it look like when you hang out with your friends? Are you always going out to eat? Are there other activities you could do that's not always centered around an eating occasion? And so the folks over in the UK really developed this. I love this map because in my mind, this map really depicts, and I just made the word energy balance here a little bit bigger so you guys could see it, but the purpose of this is to really just show everyone how complex obesity is and how all of those contributing risk factors are linked with energy balance, and this idea of this imbalance in energy and excessive intake that leads to obesity. And then when you break it down, there's this next image, breaks it down to all of the things essentially that were in the previous slide, touching on food consumption, the unhealthy diet, production, and also unhealthy diet, but your access, things that can affect your metabolism and your appetite, your activity, your environment, stress or any psychosocial issues, and societal influences. Excuse me. Okay. So we know, and I hope that I've demonstrated to you how complex obesity is with the different risk factors that can contribute. So what about the health complications? So we have all these risk factors, and what about health complications linked with obesity? So first I'm going to name a few that I'm sure may seem a bit obvious or that we may already know. So first there's type 2 diabetes or insulin resistance, high blood pressure, high triglycerides, that's a bad fat, and low HDL, that's a good fat. Metabolic syndrome, which is really a combination. You could either have insulin resistance and high blood pressure and high triglycerides, so it's in a combination of any of these things, including, as mentioned earlier, that higher elevated waist circumference, which ties into body composition. So it's a combination of all these different metabolic parameters linked together. Cardiovascular disease, sleep apnea, gallbladder disease, social isolation. So there's also some psychosocial complications that can be related to an obesity state. Gynecological problems, so this includes infertility, erectile dysfunction, and other sexual health issues. Those can also then tie into psychosocial issues. Non-alcoholic fatty liver disease, so this is when you have excess fat deposits that deposit on the liver, which can then impede the function of your liver. Osteoarthritis, depression, shame and guilt, so linked with depression, disabilities due to the obesity, and cancer. So now I'm really going to get into the different types of cancer that are associated with obesity. So this data is from the recent American Institute in Cancer Research's report that came out. So these are the 11 most prominent, based on epidemiological data, most prominent types of cancers that are linked with obesity. So as you'll notice, they're not all linked with just gastrointestinal issues from that excess energy balance. So you've got esophageal cancer, stomach, colorectal, but there are also other types of cancers: prostate, endometrial, ovarian, postmenopausal breast cancer. So this is the evidence has shown that obesity is linked with these different types of cancers. It increases your risk of developing these cancers. And here is just briefly what that data looks like. And there's actually 3 extras that weren't on the infographic provided by the American Institute in Cancer Research. There's also sufficient human evidence that has shown meningioma, thyroid, and multiple myeloma also are linked with obesity. And so this column right here, it's a large table in this paper. Here's my reference here from the New England Journal of Medicine. And so there's sufficient human evidence from the epidemiological data. And what they did was they looked at a normal BMI, so 18.5 to 24.9. They looked at individuals of normal BMI and then individuals, then they classified BMI in different categories thereafter. And so comparing the highest BMI category to normal BMI, for example, individuals with esophageal cancer were 4.8 times more likely or at increased risk of getting esophagus cancer, compared to individuals with normal BMI. So that's how this is interpreted. So another example, individuals with a high BMI, the highest BMI in the obese category, were at, for example, 1.8 times higher risk than normal BMI for gastric cancer. So this is the data, and that's how you would interpret that. Okay, let's see, what's the other one I want to find? Uterine cancer, 7.1 times increased risk. So, I mean, this link is really, really strong. Yes, ma'am?
What is meningioma?
Meningioma is when you, so I'm sorry? So it's in your brain. So you have the meningeal fibers in between in your skull, and so you'll get tumors that develop right up there. So these are the different types of cancers that are linked with obesity. So, how does obesity increase your risk of different types of cancers? Well, to understand how obesity is linked with cancer risk, it's first important to understand how obesity is linked with other health complications, because that will better define or better explain, in my opinion, the link with cancer. Excuse me. So, Yes, ma'am. Uh-huh.
My mother had a below normal BMI,
Mm-hmm.
and yet she still had thyroid cancer and had to have her thyroid. How does that affect me when, I know I'm much bigger than my mother was?
That's a good question. So the question was, I have a relative who had thyroid cancer, who was of a normal BMI or below normal BMI, and how does that affect my risk of thyroid cancer when my BMI is higher? So there are cancer is very complex, and there are very many different factors that contribute to increased cancer risk. Family history does contribute to many different types of cancer. Obesity can link to certain cancers, but it is possible if you're not obese, you can still, if your BMI is lower, overweight, or within normal range, you still may be at increased risk of different types of cancers, just depending on the cancer type. So it may not be in this specific example because you are, if your BMI is higher, that doesn't necessarily mean someone has had thyroid cancer with a lower BMI, I have a higher BMI, am I at even more increased risk of that thyroid cancer? Possibly, but there are many factors. And I don't believe thyroid is linked. Oh, yes, it is. So it is one of them, a smaller risk. So you may be at more increased risk because of BMI, but that it may not affect, because the person with lower BMI had thyroid cancer, that doesn't necessarily mean that the lower BMI also increased their risk. Does that answer your question?
Yeah.
Okay, thank you. All right, so obesity is linked with health complications. So say we eat this regular meal. So you're eating a meal, it's a well-balanced meal, we've got some protein, we've got some carbs, we've got some vegetables. So we eat a meal, and let's talk about the normal process, essentially. So we eat the food. I'm sorry?
I said I see a lot of processed food.
The salmon?
Like the rice
Rice, okay.
would be a processed food.
Rice can be processed. It also depends if you buy it out of the bag or if you get the boxed rice. So it really just depends on what your selection is at the supermarket. Because you're absolutely right. Rice can be processed, especially if you're buying like the Uncle Ben's that has the seasoning packs, things like that. So we eat a regular meal, and our blood sugar increases because carbohydrate digestion actually can start as early, depending on the type of carbohydrate you're eating, in the mouth. So our blood sugar increases as we're eating our food. Our pancreas is going to release insulin, and this is to help bring our blood sugar back to normal levels. So here's just a little picture of what that looks like. So we've got our insulin comes in, glucose is high, and then the insulin will swoop it up to bring our glucose back to normal levels. This happens over the span of a couple of hours after we eat our meal. And then our body will digest and absorb what we eat and store energy that we don't need immediately into fat cells. So that excess accumulation of fat is that storage of the excess energy, or the food that we eat. So that's what we're eating enough calories, and this is what happens. But then what happens when we have this excess accumulation where we're eating more than we need? Well, our body's going to store this excess fat into our fats, or this excess energy, into our fat cells. And then it's going to make more cells, and more, and more. Just going to keep adding all that excess energy that we're eating into our fat cells. But now the fat cells are also we're not only going to get more fat cells, but now they're going to get bigger. So we have this constant hypertrophy and hyperplasia, so bigger cells and more cells of these fat cells. And then this constant environment of these big fat cells and too many fat cells that actually causes low oxygen in that area. So you're getting this excess accumulation of fat all over in the visceral area, by our organs, in our subcutaneous tissue, and in those compartments, that actually causes less oxygen because there's just too much packed in there. So less oxygen is in those areas. And that then causes these cells, they're called macrophages. They're like they can be, and in the context of obesity, they are the bad guys. So then we have these macrophages that turn into pro-inflammatory cells. So it contributes to this increase in these inflammatory markers. And then we get more macrophages, and they come from all over the place in our body, and they just keep coming. So we get all these macrophages, and they increase this inflammation. So this constant state of energy imbalance, or constantly eating too much and that excess fat accumulation, our body stores what we don't need as fat, that's going to contribute to this inflammatory process. All those macrophages come in because of all of the cells, all the fat that's there, excess fat. So then we have this increase of inflammation, and what does that lead to, or what does that contribute to? Well, first, it contributes to that insulin resistance. And this is when the body isn't properly responding to insulin. So, as I said before, we eat, our body produces insulin, we're able to maintain our blood sugar, but when there's too much energy intake, lots of eating, excess fat storage, this can lead to the body not responding to the insulin. So now the insulin's coming in after we eat our meal, we have all this blood glucose, but our body's not responding, so a lot of this insulin's staying in the blood. And the glucose isn't going where it needs to go. It's not going to the muscles or the organs for energy. So it's just hanging out in the blood, so then we have higher blood sugar, higher insulin. It's called insulin resistance. This insulin resistance can also make your body break down fat for energy. So this increases the fatty acids, which is the simplest form of fat that's stored in that fat cell. So this increases the fat that's in our blood, these fatty acids. And this increase in fatty acids and insulin that's running around our bloodstream can then cause an increase in the production of triglycerides, which is basically when you have the glucose together and form that bad fat. And that can be deposited on the organs. So circling back to what I was saying earlier, an example of one of the health complications, non-alcoholic fatty liver disease, this can cause and contribute to that fat deposit on the liver, for example. So this is a good example or an explanation of how obesity is linked to these other health complications I mentioned earlier. So now what about cancer? Well, when we have this insulin resistance, or this increased circulating insulin, what does this mean for cancer? Well, we know that with the increased circulating insulin, this can lead to an increase in cells that are being produced. It can also reduce the old cell's ability to die, and that can increase your cancer risk. Also, when we have this increased circulating insulin, that can also increase our estrogen, and estrogen production, which increases the number of cells produced, which increases our cancer risk. In addition, that excessive accumulation of fat or too much fat tissue, that also increases estrogen, because estrogen is made in fat tissue in men and postmenopausal women. So now that's going to increase risk, because that can increase the number of cells that are dividing and producing. And then finally, this increase in the free fatty acids, so that simplest form of the fat that gets broken down because of the insulin resistance, and the inflammation, the inflammatory markers that are released in the bloodstream, and some released directly from the fat cells, can also increase our cancer risk by increasing the number of cells produced and reducing the ability for old cells to die. So, actually, before I move, or I guess we'll get into questions shortly. So let me just go back and just do a quick recap. So the bottom line is that this state of inflammation that's created by all of this excessive accumulation of fat and obesity, in addition to the insulin resistance, which is connected to the inflammation, can increase one's risk of cancer, these different types of cancers, by increasing the number of cells produced and reducing the ability for old cells to die from the increased circulating insulin and then also increased estrogen. So what can you do to reduce your risk? Well, first and foremost, maintaining a healthy weight. So how can that be done? Well, the first guideline is to stay active. So the guidelines, according to the American College of Sports Medicine, is to aim for 150 minutes of moderate activity or 75 minutes of vigorous activity per week. And you can really slice that any way you want and whatever works for your schedule. So you can mix it up and do a little bit of moderate activity and then some vigorous activity. You can do your activity in 10-minute bouts as long as it adds up to either the 150 of moderate or 75 of vigorous. So it's any way you slice it and dice it, staying active is key to help with that energy balance. Also, the other recommendation is to participate in resistance training at least 2 days a week, and this is to help build lean mass. Muscle mass is also more active than fat tissue. And what that means is at rest, you can actually burn more calories or use more energy at rest when you have more muscle mass. So resistance training is definitely advised. Now you can get your resistance training from weights, as you see in this picture here, but you can also use resistance bands. You can also do body weight training, push-ups, sit-ups, squats, yoga classes, Pilates. That's also considered resistance training. You can use your body weight to build that lean mass. It doesn't just have to be free weights in the gym. Also, eating a healthy diet. So again, picking more healthful food options. According to the AICR, the American Institute of Cancer Research, this is the new plate they've come out with. So 2/3 of your plate as non-starchy vegetables, fruits or whole grains or beans, and then 1/3 of your plate or less as animal protein. So here's what that looks like. You have your chicken here and then some veggies and a grain here. So eating a healthful diet, maintaining your energy intake, because remember, and I think that's also an important message, is you may be eating all the right food, but if you're still eating too much of the right foods, you can still gain weight. So even though you're eating healthier foods, it's still portion control is key, and that's why I love these graphics with the plate. And you can also, I believe, you can order the sectioned off plates online to help with portion control, or even at the grocery store, just going and buying the paper plates that are portioned off. That may be a helpful way to help maintain your portions. Yes, yep, that's exactly what I'm talking about. Yeah, exactly. So those are perfect to help with your portion control. Also limiting alcohol intake, because excess alcohol intake can also lead to excess energy intake. Alcohol has calories. So the recommendation is 1 drink per day for women and 2 drinks per day for men. And then plenty of rest, adequate sleep, because fatigue can impact your eating habits, as we talked about earlier. So making sure that you're getting enough sleep every night can really help with managing your appetite and not eating too much. And with that, just a few acknowledgments to my program, the Cancer Prevention Research Training Program, with Dr. Shine Cheng, who's the primary investigator of the program, and then also to the Center for Energy Balance and Dr. Karen Bazinenquist, my primary mentor, and also Dr. Susan Gilchrist, my other mentor in the program as well. So with that, I thought I had a thank you. Thank you.
Okay, thank you so much, Dr. Coletta, for your expertise and sharing your knowledge with us today. We'll now open up the floor for questions, and I'd like to remind the audience here in the conference room that you have a microphone at your seat. You hit the enter button. This ensures everyone is able to hear your questions both here and in the remote locations. For those at the other Houston area locations, we will check in with each location to see if you have questions. Lastly, those watching remotely, or if you have a question once you leave today, oftentimes you leave and you think, oh, I wish I would have thought about this. Please email your questions to mycancerconnection@mdanderson.org. So we would welcome your questions hopefully here, but if you want to email us a question, we look forward to that as well. So now let's take those questions. Any questions from the audience?
Yes, ma'am.
Hi, my question is there any data that obesity affects gender in different way? Does obesity maybe cause more cancer in men versus women? Because we saw the link with breast cancer and different types of cancer. So I'm curious about the data trends on that.
Yeah, that's a great question. And the question was, is sex affected by obesity and its cancer and cancer link? And so with that, I'll just go back to this slide that shows the data and the epidemiological evidence put out by the American Institute of Cancer Research. And so they did not look based on sex. So they just looked at total populations. And so as of right now, only the cancer types that are specific to men or women, that's the only link. So for example, prostate cancer, if you're obese, male, you have an increased risk of prostate cancer. For women, postmenopausal breast. But for other cancers like liver cancer, esophageal, the data right now that I'm aware of, I have not seen a split with gender, but it's certainly something I'm sure that has been done or is in the process to, and that we can keep. I'm not familiar with it, but that doesn't mean that it's not out there and I missed it. So certainly something to look into. Yes, ma'am.
Related to the topic of stress, you mentioned that it was one of the risk factors, and cortisol, it's one of the factors that you mentioned about
The cancer and also obesity. Could you work around the concept of cortisol and how it causes the relation?
Yeah, so the question was about cortisol, stress, obesity, and cancer risk, and how is that all connected? Well, what we know from the evidence is that increased stress may increase behaviors to extra eating and excessive energy intake, which then increases your risk of obesity, which may then increase your risk of these different types of cancers. The physiological mechanism linking cortisol and cancer risk, I'm not familiar with. That doesn't mean that it hasn't been looked at, but I haven't looked specifically directly at cortisol and cancer risk. I've just looked at obesity and cancer risk. And so extra stress can then turn your behavior to increased energy intake, contributes to your risk for obesity, and so forth. Yes, ma'am.
I thought I saw on one of the slides that uterine cancer was one of the types of cancer that was affected by obesity, but then in the picture it wasn't listed. Is uterine cancer one of the types?
Yes. Yes. Yes, exactly. So there's just two. Yeah. So endometrial.
Oh, all right.
Oh. Yes, ma'am.
How does obesity affect
Uh-huh. So the question was, how does obesity increase your risk of metastatic breast cancer, bone, and multiple myeloma?
Correct.
So it's the same mechanism. Obesity's link with these different types of cancers, it's through the same mechanism that we talked about earlier with increased insulin due to insulin resistance, increased estrogen production because of the excess fat and because of the increased insulin, and then the increased free fatty acids and the inflammatory markers that all create these different areas that where there's increased cell production, reduction in the ability for the cells to die, that can then increase your risk for cancer.
What about if you did all three at one time?
That's a good question. So obesity may be a contributing factor to increasing your risk of those types of cancers. I believe that all three of those are on this list, multiple myeloma and postmenopausal breast. But it's still the same for what we know right now, and there's still more research that we're doing. But for what we know right now, it's that same underlying mechanisms where obesity, that contribute to obesity increasing your risk of these types of cancers.
Thank you.
Thank you.
Check to see if we have- Are there any questions from our off-site?
I know we have a
audience?
question.
Yeah. My question is, with the new pyramid of eating, back in the day it was a certain list of items. Now they've changed them. What's the difference in the old pyramid versus the new one?
The food guide pyramid? The difference between that block pattern, is that what you're asking, where the grains are at the bottom, to now where they have the different strips where grains, instead of being at the bottom of the pyramid, are thicker. Instead of being at the bottom of the pyramid, now it's just a thicker band. Is that your question? The difference between the pyramids? So my pyramid now, does this have internet? I can pull it up. Do we have internet connection? So, yeah, so they still have my pyramid. The shift was to my plate, but you can still use my pyramid to help guide with your dietary needs. There really wasn't much of a difference between the old pyramid and my pyramid, other than aesthetically they changed the image. Let me see if I can pull that up, and I'll show you. So can everybody see this? So it's essentially so here was the old pyramid. Oh, no, that's not the old pyramid. Grains, fruits, vegetables, proteins, fats. It's essentially the same thing, except instead of grains being on the bottom, which may be taken as the building block, now the focus is on this well-balanced diet, and so the recommendations are to eat more grains as it was before, but it just looks different. So there's a thicker band here, a thinner band for fat, whereas with the old pyramid, the fats were at the top and the grains were at the bottom. Does that make sense? Smaller area here. So there's not really a difference between the two pyramids, and the purpose of my plate was to give people a visual of, what your plate could look like. And that was actually developed based on a long time ago, which I still think is a really effective way of dietary counseling, is using the my diabetes placemat. Does any dietitians in the room remember the diabetes placemat? I love the diabetes placemat. But my plate, it's essentially the same thing. My plate, here's what my plate looks like. The diabetes placemat was very similar to my plate. Half of the plate was vegetables, then you had a quarter grains, a quarter protein, and you had a fruit on a side, and then a cup of dairy. This basically just puts it all on one plate. Except now you're adding fruits to the vegetables, which I think that can be a little tricky because fruits still have calories. So it's important to remember that. As I said earlier, eating too many healthful foods, you can still gain weight. And then they just did the grains and protein here as it was with the diabetes placemat. Does that answer your question?
The reason why I asked that question back in 1999 through about 2005, I was part of a study here, and what they were trying to find out was should we not eat a lot of fatty foods versus having more vegetables and eating more healthier. So, okay, thank you.
Thank you. And that's still the question, right? Who's the culprit? Is it the fat? Is it the carbs? But I think right now what we really know is that a well-balanced diet and really paying attention to how much we're eating and portion control is really what our best information we have at the moment. Portion control is key. Any other questions or from other sites?
From our off-site audience? Thank you for joining us.
Thank you.
Any other questions? Okay, please, let's give a big round of applause to Dr. Coletta. Thank you so much for sharing your expertise and for being with us today. You have any value?
The first slide that you had your name and everything on.
Sure.
Sure. We hope you enjoyed our session. We have an evaluation form. We would appreciate if you would fill that out. You can leave it as you exit. Also, if you have any suggestions for this presentation on obesity or other sessions, we welcome those as well. Thank you again for coming today and enjoying lunch as well, a healthy lunch. And there's a sign-up sheet. Be sure to sign up as well today. Again, thank you again for coming, and thank you, Dr. Coletta. I hope you enjoy and have a wonderful day.
Thank you for having me.